I'm Dr. Jonathan Chung, and today we're going to be talking about how brain training might be able to help patients with chronic lower back pain. We're going to be talking about the results of this study, which was published in the Journal of the American Medical Association earlier this month, and it talks about sensory motor retraining on pain intensity in patients with chronic lower back pain, a randomized clinical trial. The reason we're looking at brain training is because, by and large, results for lower back pain are just not that good when you apply them at a population level. And this includes exercise, chiropractic adjustments, medications, injections, and surgery. Most things just don't really work that well when you compare them on a population level. The sensory motor training group started out with patients getting pain education, and they took them through a stepwise process of visualizing movements and sensation in the lower back up to the point where they're actually doing movements with the lower back. They compared it to a placebo group who got a passive therapy, but the passive therapy device was actually turned off, so they were getting a sham intervention. How were the results? On a 0 to 10 pain scale, the patients that got the actual intervention listed in blue had small decreases in their pain levels compared to the sham group, and this lasted into 26 weeks, but at 52 weeks, so at the 1 year mark, the pain levels were about the same again. So overall, long-term outcomes, maybe not so great in terms of just your day-to-day, what's your pain score. But this chart shows an improvement in disability. So when you compare what's the patient's quality of life and what their ability and self-perceived ability to do things in their day-to-day life, we actually saw steady, consistent improvements at 18, 26, and 52 weeks throughout the duration of the study in the intervention group compared to the placebo group. So what does this mean? It means that sensory motor training might be able to lower your pain levels a little bit for a short period of time, but it seems to have a really important effect on reducing your overall levels of disability. So how can your pain levels be the same as a placebo, but you still get improvements in disability? It's because when most people come to a doctor or chiropractor or physical therapist, they're actually looking for ways to not only just reduce their pain, but most importantly, they want to be able to do the activities of their daily living again. That means they may want to exercise or go for a walk. It may mean they want to be able to sleep restfully. It may mean that they want to be able to participate in regular life activities without worrying that their pain is going to prevent them from doing those activities. So no, brain training may not be a game changer in terms of changing your overall daily levels of pain, but it can provide a way to get you consistent and durable results and allowing you to enjoy your quality of life and do your activities of daily living without worry or threat.